Well, it looks like folks are connecting here. We're getting everyone on so we can get started. Let's go ahead and get rolling here. It's 11:32. I'd like to welcome you to our February 22nd meeting of the Overland Park Rotary Club. I am Jamia Haynes, your current club president-elect. I want to welcome you here today, this nice, sunny, warm day. We'll start with the invocation. Nate Harper, are you going to lead us today?
Yes. I am reading I'm reading two pieces of scripture today that I find very aspirational for my life. First is Micah 6:8. What does the Lord require of you but to do justice and to love kindness and to walk humbly with your God? The second is 1 Corinthians 13:4-8. Love is patient, love is kind, it isn't jealous, it doesn't brag, it isn't arrogant, it isn't rude, it doesn't seek its own advantage, it isn't irritable, it doesn't keep a record of complaints, it isn't happy with injustice, but it is happy with the truth. Love puts up with all things, trusts in all things, hopes for all things, endures all things. Love never fails.
Thank you. Those are always good words to hear. All right, let's move on to our Pledge of Allegiance. Please stand as you're able. Pledge allegiance
to the flag
of the United
States of America
and to the republic
for which it stands,
one nation
under God,
indivisible, with liberty and
justice for all.
Okay, visitors, do we have anyone visiting today? I'm not aware of any, but never know. Okay, doesn't look like any visitors today. We'll move on to club or committee updates. Jeff, it sounds like you have some foundation updates to share.
Yes, I just want to remind everybody that Tim wasn't available, but just want to remind everybody that the foundation would like to grant a couple of $5,000 grants to organizations that you may be involved in. And we're looking for recommendations or nominations from members of the club. So if you have an organization that you're involved with that you think is deserving of a contribution, please let Tim or me know by email, and we will gather the information, and the foundation board will meet toward the end of next month or middle of next month and award some grants. So have an organization that is deserving, let us know. Thanks, Joanne.
Thank you, Jeff. All right, we'll move on to membership. I have one update. You have saw a membership application that was circulated for Razvir Mustan. Are you here? He was going to say a few words to us. I asked him to say a little bit about himself and let share with us today, but I don't see him here.
I think he was saying that he was still waiting to get in. I don't know if the host needs to.
Yeah, I just let him in.
Yeah. Oh, okay. All right, we'll give him a minute. I have another update, a couple other ones. I just wanted to reiterate our motion last week for anybody that missed. There was a motion made by Clayton Smith that Overland Park Rotary Club would support every Rotarian every year, E-Ray, at $100 per member or more, starting in the 2021 year, with billing to start April 1st and continuing throughout the new year, 2021 to 22. Stan Myers seconded the motion, and the motion passed unanimously. So I thought I would throw that back out there for anyone that wasn't with us last week, because that's an initiative that our club has committed to, and we want to be committed to that and move forward with that consistently. So if you have any questions about that, I'd be happy to answer any of your questions. So feel free to reach out to me.
Hey, Jamie, can we do a catch up for 2020 or any back? Because I was unaware that we were not paying that already. So
I don't know if we can do that. I can check. Let me check into that and I'll let you know. Was that Chad?
Yes, I mean, I'm certainly willing to pay my $100 to help E-Ray and the club if it's something we can go back with too. So
Okay. Let me
Can't we
research.
can't we just add
Send
an
an
extra
email.
$20 when we send in our next payment? Because there's always a place for other.
I was trying to see if we can get the club credit for 2020 is really my point, but
So we can get in that standing now.
Yeah, I don't know. David, do you know if that's retro at all?
And I think we're talking about the 2020-2021 fiscal year that ends in June.
That's right.
We're trying right now, using our April 1st billing to make sure that the current year we get our donations up over 10,000, which should assure us designation as a Star Club. Now, if we went back a year, that would be the 2019-2020 fiscal year, and I think that's already been cast in stone. Okay, you're good. Great. That's where we're at.
Yeah, I can add a little bit for you, Jamea.
Sure.
If you do a little catch up, Pam can do that. Like somebody mentioned, there's room for other in there, and you can put it in there. You just need to let Pam know, because I did an other payment to make a contribution, and it came out that I had a credit on my bill, and I had to let Pam know that it was for something else, and she just took care of it. So
Okay. Yeah, I'll speak with her in that regard then too.
Yeah, and Jamea, for those of us who our company pays our membership, but we'd rather do that piece of it ourselves, how do you want us to handle it?
I'm not sure what that looks like. Let me ask Pam about that too.
Okay. Is the money going to the foundation or does it go to the club?
It goes to the foundation, doesn't it?
Okay. Yeah. So
It's
maybe,
going to the Rotary International Foundation as opposed to the club foundation.
right.
So there's a pass through. It'll go to Pam, and Pam will send it to the district, and it will be credited to your giving account and our club's aggregate of member donations.
Okay.
But this also begs the question, should we also be asking for a donation to the club foundation?
Mm-hmm. Right.
Keep going on that track, should we be asking money for Portfolio Plus, which is separate again from the annual fund? So there's more to talk about.
There's lots of opportunities, right, David?
Oh, yeah.
After last week's meeting, I sent an email to Pam, whose last name used to be Holmes, and I forget what it is now, and asked her to just generate a bill for me for all the dues and everything for the year. And she did, and Star Spangled Spectacular was still on there as a line item. And I proposed to her that we take Star Spangled Spectacular off and maybe put Club Foundation or something, word it differently. So I don't know who's in charge, maybe Doug Davidson. You could get with Pam on the wording of that bill before she generates it.
Yeah, I wonder if that was just since she created a special bill for you, because normally the Star Spangled Spectacular has not been showing up on
Wouldn't you think?
billings.
Okay.
Yeah, I think because she did a one-time billing for you, it must have pulled that in from its memory. But you can also, if you want to write a check separately from your dues billing, you can always write a check to RI and send it in to Pam. Actually, it might be best to write it to the club, but if you designate that it's for RI, at the end of each month, any money that is being funneled through the club to RI, Pam cuts a check from the club to RI, and we mail that into them. So if you want to do that as a separate payment, you're always free to do that at any time.
Jamea, as we talked about last week, I think there's a need for some fairly precise communication about this. We had kind of a hurried conversation. David did a good job of setting out the need, but it seems to me that if we had a communication that talked about how to do this so that everybody can get on board with certainly RI, which is the issue at hand, but also our own foundation. I think that would be very helpful. Maybe David and Dave and Doug and Tim and I can help construct that communication if that's useful.
Sure. Okay. Agreed. And yes, I think it would be, I had reached out to Chris and let him know about the motion that had passed, and so he could facilitate it going forward. So I had mentioned that also having another meeting in that regard. So we'll keep him in the loop.
Spotty attendance at our Zoom meetings. We need to get the word out to everybody.
Sure. Sure.
This is Dave White. One of the questions I have is if we're writing checks to the Rotary Club, but yet it's for a charitable purpose, is that a problem tax-wise, or
right.
should we just have checks going to foundations rather than to the club?
Yeah, we should get the charitable deduction, but I don't know if we will if we write to the club.
Yeah,
it's always done as a pass through, and you'll get a statement from RI that you made a donation to them, so you'll get the tax credit even if you write it to the club. That was the process in the past.
Yeah, I think that's part of our communication challenge, is to know how to make out those checks so that they do qualify. Certainly our own foundation and RI foundation are deductible gifts, so we need to make sure that's happening in the right way.
Then, Jermaine, one quick question, and this really goes with what Jeff was talking about. Gosh, I've been in Rotary for 20 years, and in different groups, these things come up frequently. For members, think of the expertise on the discussions we currently have with, a select group of people that understand all the different buckets, understand what it's going to look like. Who do you make the checks out? What's our goal for the actual club for each of those? If I could just encourage a matrix that actually becomes just a staple for us, almost like when you see the 4-way test and you can pop it up, and when you go through that, it's almost another reference for everybody. That's the matrix of all the ways to give. And I know on Rotary International on their homepage, there's all the different ways to give, but if we could personalize that for our Rotary Club, that really just lets people know, okay, the club expects this $100 here. There's the way I can give to the international. There's the way I can give to the local. There's the polio. And that might be the financial way. And then if there's the service side and you're volunteering the time, maybe there's a bucket of, here's how we do these rolling things every year and the time we need for you to do X, Y, Z. It just is a package if it's in a matrix, inclusive of the detailed on one of them that just says, here's how you can write the check. It can be part of your dues. You can write it separately. I know it'd just be a great reference guide if on the communication, it doesn't become just a letter, because on a letter, you give it 3 months and people are going to forget it again. But if it's just sitting out there always, we can always look at it and sustain that over the years, if I could encourage that.
Mm-hmm. I think that's a great idea, especially, I think some people are longtime Rotary members and this is just all, all of it, but new members especially, you come in and this can be confusing. So absolutely, I think that's a great idea, and I've noted that down. I think that'd be very helpful to all members. Any other comments on that issue? All right, one other small announcement. I'd just say thank you for the responses on the merchandise committee. We're forming a nice group. We're going to get started here. If anyone else would like to join us, it's not too late. Just let me know. So sooner than later, we'll have a choice of items that we're going to have offering with our logo on it. And so look for that soon. All right, we will circle back to Razvir. It looks like you're on now with us. And
yes.
Hello, welcome. So Razvir is president of 7 Strategy. He has submitted his application for membership this week. You saw it come through. And we thought it'd be a nice opportunity for him to tell us a little bit about himself and why he wants to be a member of Rotary. Razvir?
Okay. Thank you. Nice to meet everyone for the first time. I've been on once or twice before, but submitted the application. So real quick, a little bit about me. I grew up in Malaysia, came to the US when I was 17, went to KU, did my bachelor's and master's in aerospace engineering, and then worked for about 2 to 3 years designing airplanes in Wichita, business jets mostly. And then I realized I was not an engineer. And I was more of a business person, more of an entrepreneur. So I quickly moved into marketing, strategic planning, and then I decided to quit and start my own thing. And the first one was a complete and absolute failure. So I think you have to go through one before you're successful. And then I started 7 Strategy, which is a web development online marketing company. From there, saw the opportunities for e-commerce because we had the expertise. So then I launched another company focused solely on e-commerce, where we do industrial products, safety equipment, and we sell mainly to Walmart and Amazon from a wholesale standpoint in e-commerce. And then I also have a separate company where, again, as you deal in these spaces, you see opportunities, and it was a product that a departure from the tech world, but having the expertise in marketing nonetheless. It's more of a nutraceutical that we market into Asia. So those are the 3 companies that I'm involved with from an ownership standpoint. I run on a daily basis. And from a personal standpoint, I've got 2 boys. One is in college. He's a junior in college, and the other one's about ready to go to college. 2 boys and a dog. I think everybody's got a dog these days since COVID started. And, we love to travel quite a bit, taking the boys everywhere. Why I want to join Rotary, I think, just from what I've read and the reach of the Rotary, that it's not just local, it's international, and the diversity within the organization. There's so many different parts that I want to be involved with. It's just getting in, getting to know people, building connections, and then figuring out how I can help. That's really the main goal is really kind of finding, you get to this point in your life and you want to do a lot more good than just the rat race that we were involved with prior to this. So that's the main purpose. And most importantly, my favorite quarterback, Tom Brady. No, I'm kidding. I can't believe he won another one, but that. So anyway, that's me in a nutshell.
Very good. Well, thank you for sharing with us today, and thank you for being here. We're glad to have you join us.
Looking forward to it.
All right. Club member announcements. Were there any other announcements with regard to the club or updates someone wanted to share? I wanted to share some good news, and I have been remiss in not doing this, so I'm sorry, but we need to have this at every meeting. These are important announcements. We have a birthday tomorrow. David Austin, looks like you're going to be celebrating tomorrow, so happy day tomorrow. We hope you enjoy your special day. Anniversaries. Chris and Mary Ann Smith have 32 years they're celebrating. Lynn and Bill Intrader, 37 years. And Jerry and Jerry Ray, 70 years. Wow, that's amazing. Congratulations. Years in Rotary. Mike Tracy is celebrating 10 years. Mary Bernard, 4 years. Jim Hicks, 43 years. And Donna Owens, 7 years. So congratulations to everyone. Those are important things we should be celebrating every meeting. So we'll do that going forward. How are we doing on time? Do we have time? Okay. I would like to do a roundtable breakout session. Well, we can do 5 to 8 minutes. And I'm glad that Stan brought up the billing and that kind of thing. Because I want to, as my term approaches, well, you're going to be really tired of seeing me by the time I serve my term as president. But I have some thoughts for where we go from here. And it's such an odd time anyway. But I want to just think about how we see our next chapter. And let's just start and narrow that down to meetings. Let's talk about our meeting structure going forward. What would you like to see? Do we want to see, and the first and foremost, I would say, do we want to return to every Monday meeting? How do we feel about not having a meeting every Monday? Let's talk about that in our breakout groups. Let's also talk about our speaker lineup and guests. Do we want to do more? Maybe we pick a Monday where we feature a guest from another club, another local club, and they tell us a little bit about their club. I have recently met with the president-elect for Overland Park South Rotary, and we're sharing ideas as to what each of us do or don't do and what would work for the other, and see if we can gain any insight from one another. And I think there's something there for us to learn outside of our bubble. And or could we have speakers from our group speak every, maybe a designated Monday of each month that tells a little bit about their business. Or so think about that. Let's break out into our groups and let's think about that. First and foremost, how do we want our meetings to look going forward? Do we want to keep those Mondays or not? And why or why not? Welcome back. I know it was a short time frame, but I hope you had some good discussion around that topic. If you'd like to share any feedback with me about your group discussion or your individual input, I'd love to hear it. Please email it over to me. And you can also expect a survey soon coming out about some questions about what our programming looks like coming up. So please fill that out when you get it so we can hear what you have to say and what you want our meetings to look like. We'll move on to our program. Today we have Amy Falk, the CEO of the Health Partnership Clinic. And Patrick, were you going to give Amy's introduction?
No, that's me again.
Oh, that's Jeff. Okay.
Yeah. I'm talking too much today, but I've known Amy for a while and have been involved with the partnership for a while. So we talked last week, United Community Services was our program. And one of the best things that UCS has ever done, in my view, and one of the most lasting things, was to create, back in the 1990s, the Johnson County Health Partnership. And that kind of bumped along as a free clinic for a lot of years. And then with the advent of the Affordable Care Act, federally qualified health centers were funded to help create a way to fortify the safety net for the medically indigent. And the health partnership was well positioned to do that. It has since evolved under Amy's leadership. She joined the partnership in 2016 and has expanded its services to 4 locations in Johnson, Miami, and Franklin counties. This organization was supported by, the hospitals in Johnson County. That was the partnership name. And so Stan Holmes Olathe Medical Center was one of the major participants. And so that relationship with hospitals has continued. But since joining the Health Partnership Clinic, which is the current name, Amy has helped it integrate medical, dental, and behavioral health services and expanded new services, including a school-based clinic at Merriam Park Elementary School in Merriam, and a pediatric walk-in services, and also has some substance abuse and medication assistance treatment services and telemedicine services. So she's really brought it into the modern healthcare world and expanded its capabilities immensely. In addition, Amy has become a very strong voice and participant in county and statewide activities involving safety net healthcare. She's the treasurer for the Kansas City Medical Society Foundation Board and is a member of the Johnson County Health Equity Network leadership team. And she works with UCS on transitional age youth planning project leadership and continuum of care homelessness board. She's also on the Community Care Network of Kansas. It's the State Primary Care Association, and she has served as chair of that organization. So you can see that Amy has really become an integral part of healthcare in Johnson County. And we're glad to have you back to Overland Park Rotary, Amy. Welcome.
Well, thank you so much. I look forward to talking with you, and thank you for the nice introduction. So, William, are you going to be showing my slides? I see them there, or should I share my screen?
Go ahead and share your screen. I thought I had your slides, but I don't think I do.
Can everybody see that? Hopefully. Okay.
Yes, ma'am.
So again, I'm the CEO of Health Partnership Clinic. We are the local federally qualified health center here in Johnson County. Our mission is to improve the health of the communities we serve through the provision of high quality, affordable, accessible, and culturally appropriate care to all individuals, regardless of their ability to pay. And we do this through a number of mechanisms, including really working with our community partners, which Jeff just really alluded to, working with community members such as himself, who served as a long time board member, and Stan, I see you're on here, Olathe Health. We really couldn't do what we do without the assistance of our local partners, including Olathe Health. As Jeff mentioned, we are a federally qualified health center. So what this means is that by federal mandate, we are required to provide affordable, accessible, and quality health care for all. Hence, our mission statement. And we really focus on providing preventative and primary health care for low-income, uninsured individuals. We see all ages from birth until death. We are required to have a sliding fee schedule. So any patient cost is not a barrier to, and we update this annually to keep our prices affordable. Just a little bit about federally qualified health centers. They were started in 1964, and today there are over 11,000 care delivery sites. 28 million patients are served annually through federally qualified health centers. Just a note about the state of Kansas. There's a very robust system in the state of Kansas, and the last statistic I saw was that 1 in 12 Kansans were served at a facility like mine, making us one of the largest ambulatory networks in the state. Our goal really is to work with our healthcare systems and save healthcare dollars through reduction in emergency rooms, hospitals, and specialty care. On average, the safety nets or the federally qualified health centers throughout the country save the healthcare system about $24 billion each year. And as I go through my presentation, I'll point out that these stats were based on a normal world, not our COVID world that we currently live in. So as Jeff said, our beginnings, we started out as a free clinic in 1992, supported by our 5 hospitals, and we were mostly volunteered staff. We really just focused on acute and chronic disease, but we slowly grew, adding dental services and adopting a medical home model. Currently, we are nationally recognized as a patient-centered medical home here at our Olathe Clinic, and we also have a designation for our behavioral health center, or our behavioral health services. And we only serve Johnson County. We transitioned in 2012 to become a community health center. We began at that point to treat pediatrics, which we had never done before. We began a dental outreach program. We opened our site in Paola or Miami County. And we also really moved from a lot of volunteers to a primarily staffed model. Today, we have about 65 employees across all of our entities. So, whoops, my slide is not switching. Okay, so today we are located in Olathe. Our main site is really at Santa Fe and I-35 in the old Olathe Medical Building offices. We also have a pediatric site on the campus of Advent Health. We are in Paola, and we also opened a site in about 2015 in Franklin County. And then in Marion, we have our school-based clinic at Marion Park Elementary School. We anticipate making some changes with that and either shifting to or adding an additional school-based clinic in the upcoming year to Shawnee Mission West High School. So what we do, we provide medical care. Primary care, we operate just like your physician's office. We provide family, pediatrics, women's health, and chronic disease management. Chronic disease management is a large part of what we do. A high number of our patients have hypertension and diabetes. We also participate in a local or a national prescription drug program called the 340B program, which allows participating pharmacies that we partner with to get pharmaceuticals for our patients at a reduced cost. We also provide medical care out in the community. We partner with Olathe Health and the Olathe Fire Department and on the mobile integrated health team, where we supply a nurse practitioner who goes out into the community with EMS or with the fire department to provide care. We also provide behavioral health. This has been a growing service line during COVID. We operate an integrated model, which is a little unique. So if a patient comes in, we do depression screening on all of our patients. If a patient comes in and has indicators that they may need behavioral health, instead of saying, come back and make an appointment, we will send a behavioral health consultant into the room right at that point to address the situation and to start care. We also, in the past 3 years, have added substance abuse services. We partner with Heartland Radak and can do early intervention from children 12 and older. This has been, sadly, within the majority of our service lines, volumes have dropped. Substance abuse services have skyrocketed, the request for those during the past 12 months. We also provide our behavioral health services via telehealth to our Paola, Ottawa, and Shawnee Mission clinics. We also provide behavioral health services in schools. And just recently, we added medicated assisted treatment to our substance use program. We also provide dental services. We provide on-site dental care here and in our Ottawa clinic, but we also do portable care out in the community in both the Olathe school districts and the Shawnee Mission school districts. This, during the pandemic, has been somewhat of a challenge with schools being closed and just by nature of dental care, the aerosols put out into the air. Quite frankly, the schools at this point really don't want us in their buildings spreading possible germs. We also work closely with Growing Future, Futures, one of the Head Start programs here, and provide services there, and have also attempted or have done some telehealth and dental for remote and our outreach sites. A large part of what we do as a community health center is really providing outreach into the community, hence the name Community Health Center. We do medical and dental services out in the community. The mobile integrated unit is a great example. We also are the homeless grantee, so we provide services monthly at Safe Home. In terms of outreach, we also help enroll our patients and community members in insurance enrollment programs. Right now, the marketplace has reopened, so we are actively enrolling individuals in the marketplace. And we do a lot of community health fairs. So I would be remiss without talking about how COVID has affected Health Partnership Clinic and what really our response has been, because this has consumed my staff really 24/7 for the past now coming up on a year. So when this started, we immediately added testing capacity. So we are now able to provide rapid testing and then the PCR testing or the deep nasal swabs here on site. We have drive ability to provide those services for drive up. Patients can drive up. We do the testing and can provide those results within 20 minutes. So that has been a large focus of what we've been doing. I will say that has shifted now with the vaccines. I think last week we only did one test. We are seeing people not wanting to be tested as frequently because when they're tested, a lot of times their employers mandate they have to be quarantined until the results come back, and a variety of things. Totally had to service adaptation, safety measures, how reinventing our facilities to make sure my staff and our patients were safe. I am extremely proud and knocking on wood that at Health Partnership, no staff member has contracted COVID from a patient, nor have there been staff member to staff member exposure or infection. We've had to do a lot with plexiglass. Our dental department had to be redesigned with a variety number of high-tech air purifiers and things like that. Really slowed down those volumes in our dental department. We also, because we were able to already doing telehealth, we were able to immediately flip to doing telehealth for medical visits. So if a patient called in and said, I think I have COVID, we could do that visit really online. Telehealth for us is taking a new turn. We were awarded a grant from the federal government and also through the state to get remote monitoring devices. So we will start deploying scales, glucometers, and blood pressure cuffs to our patients that will, if they link in via their phone, it will feed into our electronic medical record. So it will really make those visits more robust. We adapted. Parents didn't want to bring their kids in and face being possible COVID exposure. We've done drive-through immunization schedules and also had well child Saturdays where only well children came. We've implemented a virtual waiting room where patients wait in their car when it's nice, certainly not last week, but wait in their car to minimize time within the clinic. And currently vaccines, we're providing vaccines when we have vaccines. Look forward to providing even more. It's been a real challenge. We received a large shipment initially to help vaccinate healthcare providers, and we've done that. And now rely on the county health department to receive doses to provide to our patients. So for instance, this week we will have no vaccines on site due to the weather of last week. So we're really looking at how do we educate people around vaccine hesitancy so that when we do have vaccines, we'll be ready to roll. And we've outfitted our facility, have it all set up to go once we get large numbers of vaccines. So how we do it, through partnerships with our staff, volunteers, obviously our hospitals providing laboratories and radiology services, our community organizations, and also funders. While we receive a large federal grant, our funders, it is a very important relationship because here at our clinic, especially during COVID, about 60% of our patients are uninsured. So we're not getting reimbursed for those. So finding reimbursement to help pay for those visits is key to the work we do. So who we serve. Pre-COVID, we were just seeing about 12,000 patients annually and doing about 30,000 patient visits. Last year with COVID, that was down to about 8,000 patients, providing about 2,100 patient visits. I will note that the majority of decrease in those visits came in our dental department, but also within pediatrics. We're not seeing, for instance, right now would be a very busy time in our pediatric clinic with flu, colds, and but with kids wearing masks, not being in school, we have not seen those volumes rebound. As I mentioned, about 59% of our patients are uninsured. That's up from 50% last year. 24% do have Medicaid. Over 12% have private insurance. 48%, just to give you a reflection of who we serve, 48% are Hispanic, with 38% of our patients best served in another language than English. So that puts complications into the work we do, especially around telehealth. More than 50% of our patients are female, and 44% are below the age of 17. And 34% live at or below 100% of the federal poverty guidelines. One of the misnomers about clinics such as ourselves is that we really don't focus on patient satisfaction or quality. We measure ourselves monthly on a number of quality indicators and do patient satisfaction surveys quarterly. One indicator that we look at very closely is our patient experience. Would you recommend us to a family or friend? And over 91% of our patients are either likely or the majority very likely to recommend us to families and friends. So that kind of reaffirms the work that we're doing. So as we look to the future, really opportunities are continuing to grow our school-based clinics. We're looking at prenatal care and just untapped patient base. Where are the needs? How do we meet those needs? And then challenges, obviously the ongoing pandemic with the associated lack in revenue, and then normal things that have appeared as challenges for safety net clinics for several years: lack of access to specialty care, lack of adult dental care resources, and then a true need for Medicaid expansion. So while COVID has been challenging, We're here to provide services to the community and continue to find ways to adapt and best meet the needs of the communities we serve. So at this time, would open it up to any questions anyone may have.
Thank you, Amy. Are there questions? Are there, Carol, do you have?
Yeah, can you hear me?
Yes.
Okay. Amy, my question is really mostly regarding after COVID, with the mental health issues that children will be facing. How are you going to deal with that at ground level, since the kids can't self-diagnose, they can't articulate, I feel depressed, or I have agoraphobia, or I have, anxiety.
Sure. We've talked about this actually as we're kind of looking forward through that. And I think part of our strategy is really within the work we do within the schools. That's where some of these problems are identified, but being in the schools, being right there to assist and provide that treatment. We also are looking at a variety of different programs. For instance, we'll be part of a pilot program with one of the Medicaid providers for foster kids to get them in for not only physical health visits, but also to do mental health assessments at that point. But really looking at that partnership with the schools. But as I said earlier, even within our own pediatric practice, we do a screening each visit every time with our patients to look for key indicators, say, of depression and other things. So hoping to catch some of those as they come up earlier. So I know my mental health providers are very busy lately with their integrated visits being called into exam rooms.
Okay, thank you.
Susan?
Hi, Amy.
Hey.
I remember when we opened the Marion Park Elementary School Clinic, and Amy might be able to speak to this, the great improvement of attendance. The attendance numbers went up because there was not only just health care provided for children who wouldn't already be able be allowed to see a physician or get to a physician or a nurse, but also dental issues. And they could, while in school, have that ability, and then they were cared for so that they could come back into the classroom more quickly. I know that's different now because of COVID, but it was a great improvement to the attendance issues, which are so imperative for those who live below or at the poverty level in our communities and in our schools. So I can just say what a great asset that is for us in Johnson County.
So, yes, thank you. And because Marion Park was a feeder school for a lot of the other schools, we don't have specific data per school, but intuitively and just in visiting with the school nurses, they were seeing a reduction in attendance issues, because oftentimes if a child showed up, particularly at Marion Park, we were able to see them that day or make an appointment for the day we were there with both medical and dental. The parent didn't have to take time off, which was another big asset, but we were able to provide that care, that point of service right at that time of need and address those issues. And because we had both medical and dental there at the same time, while the child may have come in just say for a well child checkup, as they were doing that, we would do a brief dental screening and identify, in a lot of cases, some pretty serious decay that with tooth pain, a child's not going to be able to be a productive student when they're suffering with tooth pain. So we're able to address that at that point also.
Any other questions for Amy?
Amy, I was wondering, do you have a separate budget from the national organization for Eastern Kansas or the clinics that you mentioned, or is it all?
No, we are, if I understand, I hope I can answer this correctly. We are our own 501c3. So we set our own budget, and our budget's about $9 million, $9 million budget each year. Where we get the funds from the federal government, that feeds into our budget that we supply to them.
Did you have a deficit from 2020 because of the pandemic and the complications?
Yes, we did. So we did have a deficit. 2020 was a little bizarre in that we also applied for a PPP loan. So that's showing as a debt right now, but we expect full forgiveness. So.
Any other questions? Well, Amy, I want to thank you for being here with us today. And I would echo Susan's comments that the Health Partnership Clinic is absolutely an asset to Johnson County.
Thank you.
So thank you for all that you're doing, and thank you for sharing it with us today.
Thank you. We're honored to be here.
Yay.
Thank you.
All right, next week, Mike Armstrong will be returning again he's the general manager of Water One. So we're going to try it again. He's going to speak to us next week. We'll do that. Let's adjourn our meeting with the 4-way test. Please join me. Of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill, better friendship? Will it be beneficial to all concerned? Thank you again for joining us. It was great to see your smiling faces. I hope you get out and enjoy some of this warm weather. See you in 2 weeks.